It's been called a new epidemic. Nearly 5 million Americans have heart failure, a progressive failure of the heart. And you're about to meet a woman who mistook the symptoms of heart failure for the flu.
Many years ago, this Japanese tea garden served as a place for Geraldine Boyer-Strawn to get away from life's stresses.
So I used to come here to this garden when I was a little girl.
But lately, her walks have slacked off. It's been hard for this wife, mother, and career woman to find the time. Now, though, these relaxing walks are doctor's orders, all after her health took a sudden turn for the worse about this time last year.
What brought me into the doctor was because a cough of mine wasn't going away, and I just felt it was in my chest.
At the time, Geraldine didn't think much of it.
I honestly thought I had a chest cold.
One doctor attributed the cough to asthma and prescribed an inhaler. But looking back, cardiologist Tanya Nanovich says there were subtle clues that Geraldine's heart was headed for trouble.
Often people that develop heart failure don't know that it's developing. They can have a cough, they're short of breath. Often they just have fatigue.
One sleepless night, Geraldine's feet and legs swelled up. Nausea set in. Geraldine finally made what would be a life-saving call to her primary care physician.
And she took one look at me and said, "You have edema, which is swelling and retaining fluid, and I want you to go to the ER."
Geraldine immediately went to the emergency room and checked in with the doctor.
I just remember this. He says, first of all, your primary was very correct in sending you here. Frankly, I don't know how you got here. Based on your vitals, you should be dead.
X-rays showed her heart had swollen to nearly 150% its normal size. For some perspective, take a look at this normal heart beating on the right. It's small, flexible, able to squeeze with enough force to pump blood through the entire body. But images taken of Geraldine that day show a heart so enlarged it can barely move. Valves were leaking, and fluid had backed up into her lungs.
It's horrible.
Brings you back to a year ago. But it's also pretty amazing. Pretty amazing the difference in what has happened between now and then.
In the intensive care unit, doctors used potent IV diuretic drugs to drain 25 pounds of fluid that had built up in Geraldine's body. What causes a heart to act like this? For many people, a heart attack can lead to heart failure, but Geraldine never had a heart attack.
It's the muscle wall that had become damaged with you. We don't really know 100% what was the cause of the damage. It may have been after a viral syndrome. You do have high blood pressure. It may have been from high blood pressure.
Heart failure happens most often to people over age 65, but it can also be a risk for those who are younger. The good news is doctors have a better understanding of heart failure than they've had in the past, and that's brought advances in treatment.
It's very different today. People live decades with congestive heart failure, and with treatments they can get back to almost a completely normal lifestyle, and some patients can get their heart functioning back at almost normal levels again.
Even though part of her heart muscle is damaged, Geraldine's taking this cardiac wake-up call to heart.
It's my kids that are in the back of my head. You know, I want to see them grow up. I want to see them fulfilled.
By overhauling her lifestyle, exercising, eating more healthfully, she's already reduced her prescription medications from 8 down to 2. Now she's passing this life-saving message on to her children. Take care of your heart, lower your blood pressure, reduce the stress in your life, and do what you can to keep heart problems from happening in the first place.
But you know what? It's your body, it's your life. You know, doctor's there to help you, but you got to make that conscious choice.
How can you reduce your risk? For starters, keep your cholesterol and blood pressure under control. For more tips and to learn about heart failure treatment programs in your area, visit sutterhealth.org.